Hi, everyone, and welcome to the Muslim Sex Podcast. Thank you so much for tuning in. I really appreciate your patronage, and I would love it if you could leave me a 5-star review because that really helps me. And if you could like and share this episode with somebody that you know that may benefit, your friend, your colleague, anyone, I'd really love you to share this podcast, especially if you find value in the Muslim Sex Podcast. Also, I'd love for you to subscribe to my YouTube channel and follow me on all my social media. Also, as you probably know, if you've been listening to this podcast, is that I have a practice that is now open in Chappaqua, New York. I see patients for menopause and sexual health, as well as regular gynecology. So if you are looking for a gynecologist that actually spends time with you, that has time to listen to you, then I would invite you to come and see me in my practice, and I'd be more than happy to take care of you. So make sure if you live in the New York area, or even if you don't, come and see me in my office. I'd love to meet you. And also, last but not least, is that I am hosting again my retreat in Morocco for 2025. So if you are looking for a gift for a family member, a friend, yourself, make sure you take a look at our retreat, the Love and Nourish retreat. It will be held September 19th through the 26th, 2025. Again, this year in Morocco, we will be visiting the same towns. We will be in Marrakesh and Essaouira. And as always, we will be providing information and lectures on menopause, perimenopause, nutrition, and also going for cooking classes as well as excursions. So don't miss out. I know a lot of people were sad when they missed out this past year on the Morocco retreat. So make sure that you go and visit the Love and Nourish retreat hosted by Caria Retreats. And now onto the episode. I am an American board certified OBGYN, a mom, a Muslim, and I'm talking about sex. This is the Muslim Sex Podcast. Well, welcome to the Muslim Sex Podcast. I'm your host, Dr. Sadaf, and this episode is everything you need to know about intimacy and urology and where it starts and where it goes and all the things in between. But before we get into it, one thing I want to make very clear, actually two things. One is definitely not giving any type of medical advice. So if you have any questions about your health, definitely seek help from a healthcare provider, and not giving any religious advice. If you have any questions about your religion, please speak with your friendly neighborhood religious leader. This is the Muslim Sex Podcast, because I just happen to be a Muslim woman that talks about sex. So on with me today is Dr. Londoño. Is that correct? Am I saying your name right?
Yeah, Diana Londoño.
Yeah, Dr. Diana Londoño. And Dr. Londoño comes to us from LA. So Dr. Londoño, please introduce yourself to the audience and viewers out there.
Thank you so much for this invitation and for opening this discussion, which I think is so crucial for anybody, really, no matter where you are in your sexual life. But I'm a urologist in Los Angeles. I'm also originally from Mexico City, so I spent 12 years of my life in Mexico City and then moved to the United States. So I sort of have the perspective of the different cultures and how we view sex and intimacy and talking about it or not talking about it.
Oh, that's fantastic. I think that's so important and so needed, right? Because oftentimes we only hear one narrative, and, it's the popular narrative of whatever group that you're living among, right? And so it's really important to hear all different aspects. So I'd love to know your experience growing up in Mexico, and about, what the ideas or sex education that perhaps you had back in Mexico, if you had any. I know that here in the US, our sex education is really based on zip codes, and wherever you live, that's the type of education that you get. Some people that live in perhaps New York may get different types of sex education than perhaps somebody that lives in Texas, right? So I'd love to hear what your experience was growing up and where you learned about sex.
Well, that's a great point that maybe is zip code related, but interestingly, I mean, at least for me and my family, I think it's something important to think about it. It may not have to do with a zip code. Your zip code is just your home. And what happens in the home and those conversations, that's really where you're going to get your education. So I don't think it's going to happen per se, or we have to put it off to a school system. It'd be great if we definitely go into it. But I really think, regardless of whatever education is in the school system, it really has to happen at home. I think those conversations about just identifying the anatomy and calling it by the correct words is crucial when you have little kids. And then just normalizing talking about, in an appropriate age, matter, how kids are, coming to the world, what happens in intimacy, and then start talking about, birth control and all those conversations, early on. And I think I was very grateful that in my household, I mean, these conversations were discussed very early and, even before I was ever sexually active. And that didn't happen till later. But I understood, what can happen. I understood, what are the consequences of sex, whether it would be pregnancy or STDs, and what happens just from the relationship standpoint, like that intimacy, of not just having sex, but of that relationship, of the commitment and things like that. So those conversations, thankfully, were very early, despite being in a culture that perhaps people think we don't talk about it. And it is true that perhaps, yes, as a culture, we don't, but I think it's essential. And it just shows that even no matter what culture you're in, you can definitely talk about it if you make that effort. And I think it's really important because otherwise, people truly are going to have sex no matter what. And then you don't have the skills to understand what's going to happen again emotionally or even with STDs or things like that. So just starting at home, I think, is the most important thing.
Yeah, I agree with you. And, the thing is, though, that a lot of people do not feel comfortable talking about sex at home, right? I know that there's a lot of people that have been raised in, with sex negativity or in cultures or communities that do not discuss sex. And definitely, I can tell you that, a lot of people that I have discussions with, sex was definitely not discussed at home. So I think that's fantastic that, you and your family uh, were able to have that discussion, right? That education started with your family. And I think that that's really important. And that is definitely the ideal way to have it. And regardless of where you live, like you were saying, maybe it's not the zip code, but I would say that actually for people that, that discussion is not commonplace at home, they do get their education from school, and only if their parents allow them to go to that sex education, right? We also know that a lot of people, parents don't feel comfortable with schools teaching their kids sex education because they're like, well, I don't know what they're going to teach you. So they may not allow. I know a lot of people where, their families, their parents didn't allow them to go to the sex ed. So, here we have a situation where, parents are not talking about it at home. And so they don't get the education at home. And then when they go to school, their parents maybe they didn't let them go to that sex education. So really, where are they getting that education? So I think it's fantastic that, you had that discussion at home and your parents were very open about it. And I think that's really critical because that really leads to, that's where the sex positivity starts, right?
Yeah, and being comfortable in your own body, being loving about your own body, and I think that is something that is not truly, like, let's say, taught, but you observe it. I think when I was growing up too, I saw a lot of that. There was no shame, and my mom was, her very like loving her own body, and I think that also just so good gave me that permission as well because I see a lot of women that they really talk about themselves in a very negative manner. They talk about their bodies in a very negative manner. And then that really translates into all facets of life, but definitely also in the bedroom. I mean, that's another place you're going to see that. But again, understanding that the way you talk about yourself, the way you see yourself is going to, present in many ways. And it's also, very important that we sort of open that conversation and be mindful. And if we hear that sort of negative self-talk, to kind of squash it and say, hey, like, is there a different way you can talk about, your body, yourself? Because I think that the words really do matter as well.
100%. You're so right. Definitely the way that we talk to ourselves, because then the way that we talk to ourselves actually becomes a soundtrack in our head, right? There's actually a book called Soundtracks by John Acuff, and he talks about how, we have a tendency to repeat the same narrative over and over. We may say to ourselves, like, I'm not good looking, I'm not, maybe I'm too fat, whatever it is, whatever that negative self talk is. And we say it so much to ourselves that we believe it because it's because of the soundtrack that's running through our head over and over again. So I think it's really important to have that, positive self-image and really love yourself the way it is right now. And I talk about that all the time is, really important to love yourself right now the way that you are, not wait for, sometimes people will be like, oh, maybe after I lose, a certain amount of weight, or maybe after I do this or that. And really important to have that self-love right from the beginning, right? But sometimes we're not always taught that.
Yeah, I mean, I think even if you're not taught, you have to try to realize, okay, I was not taught that, but I want to cultivate that for myself or for my children. So sometimes the gift that we don't get is the biggest gift because we realize we didn't get that, that wasn't done. I want it different. So I think even if you got it, you did it, you can still look at it in a different light and say, okay, this is how I want my life to be. This is how I want to teach my children about it. And again, it's crucial because then that puts us in situations where, first of all, if you don't love yourself, nobody's, you can't be loved by others if you don't start with self. And it's gonna show up, like I said, in your work. Are you okay being sort of beat up and traumatized and not standing up for yourself? Is that also gonna be in the bedroom, asking for what you want, for things that you like? So you gotta sort of know yourself, and know what you like, know your needs to then be able to translate that into all facets. But I think it starts early.
Absolutely. I love how you said that, intimacy is not just in the bedroom, but it starts actually outside of the bedroom. And I say the same thing. I think that, I always say that whatever is happening outside of the bedroom is going to happen in the bedroom. It's the same idea, right? Is that if you are not loving yourself outside of the bedroom, you're not going to love yourself inside the bedroom. And, you're going to end up spectating, right? Like watching yourself. It's going to be like an out of body experience. And you're going to be like, wow, I'm really fat, or I don't like this, or I don't like that about myself. And then that really impacts whether or not you are actively participating in the intimacy that's happening, right? Because you're so busy judging yourself that you don't really participate. And then I think a lot of times women will say that they don't enjoy sex, or they don't enjoy anything about it because they don't get anything out of it. And I think that sometimes it could be lots of things, right? It could be, we as sex med docs, we always talk about the biopsychosocial factors, and assessing somebody that way, looking at biologically, psychologically, and socially of what could be impacting their relationship. But also it could just be that they are not fully engaged because they're not really engaged in the moment, right? And we know that when you practice mindfulness, when you are in, and I love this author, her name is Dr. Lori Brado. She talks about better sex through mindfulness, but she talks about how just really being present in the moment, and they've done studies on this, actually will lead to increased arousal, libido, and lubrication in women that come in for decreased libido, because they are very present in what's going on and really tuned into what's happening physiologically in their bodies.
Yeah, absolutely. I think mindfulness is important. Communication is essential. And again, if it's not happening outside the bedroom, it's not going to happen in the bedroom. So if you're not having that connection, I mean, I think, you know, uh, anatomically, hormonally, of course, we think about desire and testosterone and all these other factors, and those are important. But it's also interesting that you can have somebody with very low testosterone and have great desire, which you would think like, wow, it's only testosterone, that's only the factor, but that's not really true. There's so many factors that play into your desire. That's sort of an energetic component of pull. I mean, if we think about our heart has like a bigger like electromagnetic potential than even our brain when we check out EEG or EKG. So, it's a pull, and you can even feel that and measure that, feet outside of our own body. So how can you feel that? Like it's a pull. And that pull, that big connection starts in the heart. So there has to be that love heart connection. There has to be that communication where you talk about what you need, what you desire, what you like, what you don't wanna do. And then obviously your sex, organs are gonna be, also responding. They're gonna be lubricated. They're gonna be ready for that penetration or, that intimacy sexually in the physical connection. But it all has to come together. And so I think there's definitely an energetic component. There's, a physiological component, and there's a communication and a love component. But again, we gotta be communicating, what we like. We gotta say, even physically, we see so many women as physicians that are perimenopausal, and it hurts and it burns. So who's gonna be wanting to have sex when it's hurting and burning? So if you don't communicate to your partner, like, maybe there's changes now that there weren't there 5 years ago, a year ago, it's uncomfortable. Let me figure out before we start, penetrating because it's painful. That's not going to be pleasurable. You're not going to be in some moment you want to be in if you're having pain, if you're having discomfort, just physically. And then again, that just really translates into other types of pain where you're not being heard or you're not advocating for yourself. So it all goes together. And so it's important to look at the physical components, if there's any pain, discomfort, talking about, there's changes, talking about things that you want, and also understanding the self-pleasure, even within the intimacy, that's important because that is, something that where you explore your body, that is something that is not shameful to do in the bedroom or, on your own, because it's important to, take care of yourself. That's part of, health is sexual health. So taking care of yourself in those two aspects, again, translates into everything.
Yeah, yeah. Communication is so important, And like you said, I think that, if you're not communicating outside of the bedroom, you're definitely not communicating in the bedroom. And, that was actually they've done studies on female sexual satisfaction. And that was the number one factor for female sexual satisfaction. It was communication. It wasn't anything else. It wasn't like lighting, nice dinners, whatever, whatever we think it might be, flowers, this and that. But it's really just communication, being able to communicate with your partner about really what your desires are and what your wants are. I think what's also interesting is that sometimes, women are afraid to communicate their desires because perhaps their partner might think of it as a criticism, right? Like, oh, you're not, oh, I'm not doing this right again, or oh, I'm not doing that right again. And so any suggestions on how that might, how might that be better communicated?
I think if you're, in the bedroom again, yeah, that's in the moment, but then those communications can happen then, but also outside. So when you're not, in the moment, you can say, I really like when you did this, or I prefer this, and that was really, nice, and I really enjoyed that, and this is how I like things to be done, or that was just really pleasurable, or like, I like when you start here or there. Again, sort of, really talking about things you like and given sort of the compliments of the things that they do well without focusing on all the negativity. So we always have a negativity bias in everything we say or do, and we wanna kinda go there first. But maybe it's important to praise and thank for the things that you did like and went well, and then, go to the other parts. But, it's like a dance, we have to kind of take one step, move one step, and go with sort of the flow of what we have seen. But it's important to, say kindly, appreciate the things that you do like, and again, understanding the things that you do like, because you may not even know what you like, and you may just sort of, like I said, be there without being in the moment, just kinda, doing this as a duty. But it's not a duty. It should really be something very pleasurable that is, bi-directional. Like both parties have to really be enjoying it and have to truly be like a union. I mean, it really is a spiritual union, not just a physical thing like going to the gym and getting a little workout. I mean, it really can be much more if you incorporate the other aspects that include, again, communication, pleasing each other, not just one way situation, and it really can be a really beautiful union when you incorporate all that.
Yeah, I love that. I'm curious to know, as a urologist, what kind of sexual dysfunction, specifically female sexual dysfunction, do you see? Do you see like pain with penetration? Do you see, anorgasmia? What are the things that you might see?
Yeah, I mean, we see all of it. I mean, we definitely see, pain, which can be just from the changes of menopause, and it could be vaginal dryness. But we also see a lot of pelvic floor dysfunction, and there's a lot of tightness of the pelvic floor muscles, and that
Mhm.
also can cause a lot of pain because basically the muscles that hold up your, bladder and vagina, they can get really tense, just like your shoulders get really tense, from typing. So the muscles there can get very tight, and if you imagine the muscles being tight and sore, tender, and then the penis or anything else goes in there, it's gonna hurt. So it's not gonna be pleasurable. And sometimes people don't know, why they're having pain. And so they try to avoid it or they kind of like try to do it, but it's not comfortable. So a good exam can definitely show you as a urologist or a urogynecologist or your primary, feeling those muscles inside of the vaginal canal and feeling to see where there's tightness and discomfort. And then, something very, very helpful could be physical therapy. I also do muscle relaxing suppositories, like, Valium is a common one you can use where you either put it in a woman vaginally or rectally and can really just relax those muscles that are tense and tight. So again, physical therapy, there's a lot of vibratory tools that you can insert yourself outside of physical therapy that can vibrate and massage. It can be very helpful. So I really like using some of those because you can just do it at home and target it yourself. Sort of like having, like those Theragun massagers, but now you're going internally, going in those areas that are painful. And then once the pain goes away, you could definitely use them for pleasure. But it's important to, before you get to the pleasure part, deal with the pain. So yeah, we have definitely changes from, the atrophy and the changes in the vulva. We have the pelvic floor muscles. We may have, women that, cannot reach orgasm. And so it's important to not just look at, the relationship as well, but also medications. Many medications are gonna cause that as a side effect. So, yeah, it's important to look at your medication list as well. Those are things that we use in men for, premature ejaculation. When you're having your ejaculation before you want it, we use some of those medications to delay ejaculation. So again, side effects have to be looked at, what's happening physically, and obviously in the relationship is very important as well. History of trauma, very important. One for women may, have had sexual assault in their life. So it's really important to address that, to understand that, also especially during an exam. This can trigger a lot of trauma just from the exam. So, as a healthcare, as a physician, it's really, really important to be aware of that and be mindful. And again, deal with those exams, in a cautious way, because a lot of things can be triggered. And even just from actually the pain point physically, that really brings sort of the trauma of the event. So it's important to be very mindful.
Yeah, absolutely. I'm curious to know what medication. So you said you use Valium sometimes for those tight pelvic floor muscles. How do you do that? Is that
It's a
what?
compound. Usually we do a compounding pharmacy, and I
Okay,
think it's a suppository, and we'd be a compounding Valium, and it's just, inserted at night. Usually is the best time because, you can kinda sleep through it at nighttime, and
right.
it just will relax those muscles, and it can be, really, really helpful for women. And again, physical therapy, key, 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 key as well, because you need both components. And so I find that doing both is better than one, but if not, physical therapy can be, very, very helpful.
Yeah, some people also end up having to have injections, right? Botox in the pelvic floor to help relax those muscles because sometimes those muscles are so tense that even the Valium sometimes doesn't help. Have you noticed that?
Yeah, you could do that, or like any like lidocaine, or any, the trigger point injections in the pelvic floor area as well. Everybody's very different, but I haven't really had to resort to going that far for most of my patients. I mean, it's very, very, very few that get there, but definitely the ones that need it, it is an option. But most of the times, again, addressing what caused the tension, because it's one thing to sort of treat it, but then what caused it. And a lot of this is definitely a lot of stress. So we hold our stress, we hold our grief in areas of our body. So
Yeah.
when we are aware and we have that mindfulness, like, oh yeah, I'm have this stressor in my life, I'm holding on to this, and then it's sitting somewhere in my body and then becoming pain, then understanding that really can help release some of the tightness, and not just going by physical therapy or any muscle relaxant. So it's really important to address the source, what's causing it, and really working on that. I also find very helpful to do, warm salt baths with salt, and having my patients be in warm salt really pulls that stress energy out of the body. And you can think about it just like when you go to the ocean. You see the surfers, they're very happy, they're relaxed. I mean, they're sitting in salt water, for hours. So that salt really can be very, very relaxing, and it can help remove all that stress energy, as well, which sits all over your body, but definitely on the pelvic floor.
Mm, that's so good. Yeah, absolutely. I like how you said that, sometimes you can carry a lot of trauma, right? And in your muscles, and specifically even in the pelvic floor muscle, right? You carry a lot of that tension that some people, have it in their shoulders, and, but some people really carry it in their pelvic floor. And especially if they've been assaulted or abused or anything like that, right? Then they're carrying all of that pain and that grief in those muscles. And so I think that definitely pelvic floor therapy. And like you said, sometimes you need medications to help relax those muscles. And other times there are somatic therapists, right? Those that can really help you to get in tune with your body and see where you're carrying all that pain and help you to release it. Like you said, it's not just anatomical, but it can also be psychological. And I find that a lot with vaginismus patients, where you have that, with vaginismus, honestly, I think that you need like this ideal triad, right? You need this sex med doc, you need a therapist or a sex therapist or sex coach, and you need a pelvic floor therapist. And you need all three of them for this patient to really help them to work through whatever it is that is causing them to tighten up the muscles so much that they experience pain, everything, anytime they have any type of penetration. Right, with vaginismus, so much of it has a lot to do with what's going on in their head and this fear of penetration.
Yeah, absolutely. I think you need all three. I mean, doing one is helpful, but again, addressing the different factors that led you there is key because again, if you just focus on physical and then don't do the other, it's a band-aid. It's going to be helpful, but we really have to go deeper because there is, so much trapped there. And we know, for example, if you do any type of like asana or poses of yoga, if you do like a pigeon pose where you're releasing those tight hip flexors and all the pelvic floor areas, I mean, a lot of emotions can surface at a time. And I mean, you can start just crying because you start releasing by the stretching all those emotions that get trapped. And, when you have a traumatic event, what happens is you get the trauma, you clench down, and the muscles, the area stop getting that blood flow there because you clenched down during the traumatic assault or event. And then it just leads to pain because it sort of like becomes ischemic. There's no blood flow there. And then it gets really tight and it just, painful because there's not a lot of blood flow. So, once that starts getting released, starts getting stretched, lengthened, you start releasing those memories and that pain. And obviously it's very painful, but it's very cleansing and releasing to purge all that emotional baggage as well.
hmm I love that. I didn't realize, with the pigeon pose, I guess there's so many other ways to also help release it, but that's fantastic. I love that how, doing yoga and different poses can help to not only stretch those muscles, but help you to release in so many different ways, right? Whether it's emotional or physical to help release whatever the pain that you're going through. So I love that. I think that's really important and really important information. You talked about energy. And I'd like for you to focus a little bit more and delve a little bit deeper into, what type of energy you were talking about in intimacy and relationships.
Well, we are energetic beings, and I didn't say, but Einstein said, we're all energy, and we are energy. Again, if we measure on an EKG, EEG, we're measuring energy. There's electrocardiogram, electroencephalogram. So we are energetic beings. And, we as physicians don't like to think about it. We don't like to kind of talk about it. But, we have energy centers. We just do. And, they can be, in other cultures called chakras. And then there's channels called meridians where they travel. And when the energy gets blocked, then we start having problems. Again, when that stress energy gets blocked in the pelvis, what do we get? We get pain. When it gets stuck, here in the center of our chest, we start getting like stress ulcers and heart disease and problems because we have that anger stuck here in this heart energy center or in the solar plexus as it's called. So, those are real, but in Western medicine, we just say, oh, you have a stress ulcer. This is your medication, your PPI, or whatever you're going to do. That's okay. But if we don't understand something is blocked or something is not moving, then, it may not get better just with the medication. Again, understanding that there is energetic causes to some of these diseases. And most of the physical things actually start in the energetic part of our energetic centers. So just understanding that. So if we think about in a sexual union, of course, our energy centers, what's getting activated, what's getting blood flow, that's energy, what's getting all that, it's our sexual centers. But, if you think about something like Kundalini, like that energy that rises, what that's talking about is like when you have a sexual union with your sexual organs, if you're able to move it up to your heart, to have that union in the heart, to move it up to your throat chakra, your energy center in the throat, that's a communication. So you're moving things up and it's becoming more blissful. The whole goal of that is to move it up to your crown center, move it up to your higher self. It's that sort of spiritual, energetic movement, during a sexual act that can be very blissful. So why people want to have the sexual union is really a sexual union with like God, really, with spiritual, with whatever you believe in, out there as that energetic thing. So, it's not just energy of like, yeah, we're burning calories, but what's happening in all energy centers to move it up to a more blissful union. And that's really sort of some of the energy. But a lot of us just sort of get stuck in the lower part. Like, okay, we're just having orgasms. We are, ejaculating all this is wonderful. Yes, it's very pleasurable, but there's definitely more if we are able to move it up to different ways energetically. And obviously there's a whole, you know, there's tantra and there's so many things, so many ways and mechanisms to sort of, explore that much further. And I think that's a whole different conversation, deeper. But, there are many ways to make a sexual union be, blissful in different ways if we want that. And I think it's important just to maybe explore it, think about it, and not be afraid of things that maybe we don't understand, but always be curious. I think curiosity is so important because it just opens our eyes. It makes things different. It makes things exciting. Maybe we explore different ways to do things that may get us out of that rut of like the same routine. And so when we get curious, it's always kind of fun. It's always like exciting, something to look forward to. So just understanding a little more of our anatomy, our who we are, that we are energy, can definitely give a different dimension to many things, not just sexuality, but, to everyday life.
Well, that was a lot. So I'm really curious now. So are you a yogi? Do you teach yoga? Or you just know about the chakras?
I don't teach yoga. I mean, I practice like the asanas are the poses. I've practiced that for many, many years. I'm a Reiki masters, which works, with energy. I also am a pranic healer. So prana is energy. And so when you can use energy to do many things, but one of the things that we can be done is use energy to heal. We do that a lot with things like acupuncture. We're looking at little needles that are placed along these meridians, these energy channels, and then there's changes, right? There's improvement in pain or different symptoms by changing how these channels, are flowing or not flowing. And we don't have to get too uncomfortable because let's say even in urology, we use a treatment called PTNS, percutaneous tibial nerve stimulator. That means that women or men that have overactive bladder symptoms, going to the bathroom a lot, frequency, urgency, how can we slow down their symptoms? Well, we stimulate the tibial nerve, by the ankle, and you put a needle there, just like an acupuncture needle, and then you stimulate with energy. So we are using energy to stimulate and reroute that nervous system to calm down the symptoms of overactive bladder. So we can use energy in many ways. I mean, it's not something that we do routinely across medicine and Western medicine all the time, but we do it already and it's, FDA approved and all this. So again, when we understand more about how energy works in our body and how we can use it to heal in different ways, it's really, really important. And it could be a very good way without medications or things to be an adjunct to treatment.
Mhm. That's great. So how do you talked about moving that energy from the pelvis to the heart to the brain. How does somebody do that?
Yeah, I mean, that is, like I said, a whole, you
Master class, huh?
yeah, it's just like a whole, class of understanding, tantra and kundalini and connection and how that works. So I think it's not like, okay, I'm just gonna move it, I'm just gonna sit on it and think how it's gonna go up. I mean, again, we have to have this bond, this connection way outside the bedroom first, where you can have an open communication, with your partner so that when you are in the bedroom, again, you can obviously start with the sexual act, with the pelvic floor, the organs, the lubrication, the all that excitement. But then we have to be like talking from the heart. What do you want? What do you need? How can we do different positions that are pleasurable for both of us? I mean, that's coming from the heart. How are you having? Are you having discomfort? Is this position good for you? I mean, that's communication, but it's love. It's being tender in the moment. It's being mindful in the moment, not just like, here we go, like how fast is this gonna be or how slow. It's like being in the moment, understanding what is needed during each moment that you're there with your partner, again, to bring that union to a higher place. And again, it comes from heart, from communication, and then, hopefully, join it to a higher place. But yeah, tantra is a very It's a whole thing, and it's not for everybody to do. But I think just understanding, that there could be other things we can explore.
That's great. Yeah. I actually had a Tantra practitioner come on my podcast. I believe it was, and if it was last year or earlier this year, and she talked a little bit about Tantra. But this is, it's great. It's always great to revisit topics and find out how different practitioners practice and how they put it into intimacy and relationships. I think that's really important. Are there some things that, like a pearl or something like that, that you think every person should know about, regarding your specialty? Like, for example, when it comes to intimacy or relationships, what do you think would be a pearl for, say, a man or a woman or, anyone really, anyone that's looking to create intimacy in their relationship?
Yeah, I think it's, first, I think as a man, I think it's okay to talk about changes. It's really, really important to talk to your partner and definitely talk to your physician if you see changes, because so many men feel a lot of shame, like that they've always tell me, like, I don't feel like a man, if I can't do X, Y, or Z, or I can't last this long. So it's important to talk again to your partner openly about, like, there are changes, and then maybe I'm gonna go see the doctors to see what it is, and also to understand also as a man that men with erectile dysfunction, having an inability to start maintain erection, that is really a sign or a symptom of heart disease. So, future heart disease. So it's important to get checked, your cholesterol, your glucose, your risk factors. So that is really important, that something to watch out for, not just, okay, this is happening, but what does it mean, and what are the implications? And for women, it's so important, again, as we get older and entering perimenopause and menopause, but there's going to be changes, and that you don't have to just have sex with discomfort and pain and issues. And it's really important to, again, see a physician to talk about, like, what can you do preventative, because you want to prevent that pain. You want to prevent before you get to pain. You want to prevent UTIs or infections. Such a high risk of UTIs that I see as a urologist all day is because women are not put on vulvar, vaginal estrogen, which is safe, which does not cause cancer, it does not cause blood clots or dementia or any of the things that are on the label, which is, hopefully being changed, actively. Many urologists and other physicians are trying to change that. But it's important to be preventative. So not get to the point where you have infections, pain, dryness, itching, urgency from the changes from menopause. So just be proactive. I think that's the most important thing is, if you're afraid, what is your fear? Many women tell me, oh, I'm going to get cancer, so I don't want to use that. I'm like, you're not going to get cancer, and your risk of GI and sepsis is so high that it's just like the risk benefit, is not really quite, right. And so talk to your doctors about things if you have any fears, but just be proactive and understand some of these changes may lead to other problems or other conditions. So just, get things checked up if you don't feel things are right.
Yeah, I think that's really important. And I'm glad that you advocate for that, because I say the same thing. Is the most important thing is for you to be informed about your own body and to know what's going on. And if you notice changes, to make sure that you go and have that addressed by your healthcare provider, because, I think that early onset, right? When you deal with things early on, it's a
Mhm.
better chance that it's going to get resolved or fixed, as opposed to if you wait long and go years, then, like, for example, with the gender urinary syndrome of menopause, right? Like, women will end up losing their labia minora. They'll have, their the vaginal opening will become smaller. They'll have, some women can even experience lichen sclerosis and things like that. So really important for women and men and really everyone just to be aware and familiar with their bodies, so that they can go advocate if there is something going on, right?
Absolutely, yeah. Just I think prevention is key, and sometimes we don't do enough of it. And so I think it's so important, whether we're talking about our sexual health, where we're talking about preventing infections, preventing anything. I mean, kidney stones, as a urologist, we do a lot of things that we can definitely prevent. So not just treat it, but, like, why did it happen, and also can we prevent it before we get to the point?
Right, absolutely. Like, prevention is absolutely key. So for everyone out there that may be listening or watching and is saying, like, wow, Dr. Londoño is so amazing. How can I work with her? How can people work with you? How can they find you?
Yeah, they can just go to my website. Is just my name, Diana Londoño, MD. medicaldoctor.com, and you can look up information there about me, reach out to me there. I'm also always on LinkedIn and social media. But for patients or patients that want to come see me, that's probably the best place. So yeah, just check it out, DianaLondoñoMD.com.
All right, amazing. Well, thank you so much for being on and sharing your expertise with us. We didn't really focus on men's sexual health too much, but I think that, it's a few things that you said about men's sexual health, which one of them is talking about erections. And if you have a hard time with that, that could actually be a sign that there may be some heart disease, right? And so really important to get that assessed. So, well, I really appreciate your time and thank you so much for coming on. And well, then this has been real and really intimate. And remember, this is not meant to be any type of medical advice. If you have any questions about your health, please speak with your healthcare provider. And until next time, this is the Muslim Sex Podcast. So thank you for listening to the podcast, and make sure you leave us a review, share and like the podcast. And if you leave me a review, I'd love to shout you out on social media. So be sure that you share it with all your friends. And thanks for listening.